Hello everyone and welcome. I have had a lot of requests to talk specifically about inner knee pain. So we are going to take last week's topic, knee pain, and dive even more in depth and focus on inner knee pain specifically. So let's talk about some of the common causes of inner knee pain. And one of the most common causes is you'll see there are three muscles. If I actually continue the green line here, you'll see there are three muscles that go into the inside of your knee. The first one is called your semitendinosus. That's a hamstring muscle. The second one is called your gracilis. That is a groin muscle. And the third one is a muscle called your sartorius, kind of drapes along the or across the thigh here. And what's important to know about these muscles is that because all three of them develop tendons that go in and insert into the knee, you can see why this could potentially be a cause of inner knee pain, and it's actually one of the most common causes of it. And what can happen over time is people can develop some tendon irritation, which will give them inner knee pain. Interestingly, a lot of times what will happen with inner knee pain, if you are having this type of knee pain and maybe you go see someone and they do either an MRI or some other type of imaging, is sometimes what will be found inside the knee joint itself is something that's called a meniscus tear. And that will be given to people as the reason why they're having inner knee pain. What's important for you to know is that research shows that people can have meniscus tears on their MRI and have no knee pain, as well as about 70% of people are able to avoid meniscus surgeries. That's because we know the knee is very good at adapting and healing. So if you have this inner knee pain and you've been told it's because of a meniscus issue and that you need surgery, you have that information, and know that this muscular aspect is an incredibly common cause of it. So now let's talk about, all right, if you have this inner knee pain, what's important for us to look at and what's important from a mobility and a strength perspective. So there's two things I want you to notice here. The first is that we have this inner knee, all these muscles feeding into the inner knee, but what's just as important is the muscles that work with this area, the muscles that work functionally with these muscles. And those are the muscles through the outer hip. So we have this outer hip muscle called a gluteus medius, which goes and attaches to your IT band, some outsides of the quads and hamstrings, and then goes into the outside of the knee. So oftentimes what can be particularly effective if someone's having inner knee pain is doing outer hip strengthening. That's because going and strengthening this area can help to reduce the amount of tension and pressure going through this area in the knee. All right, so that's one important aspect when it comes to the hip. We of course want to look at the knee itself, and I have some previous posts on this you can go back and review. I think I have a reel or two. But something that can cause this inner knee pain that's knee specific is your knee joint actually rotates. So if you imagine kind of a barber pole spinning like this, your knee joint does that when you bend and straighten your knee. So if there's some block in that rotation from a mobility or control standpoint, that can often also be a reason that someone has this inner knee pain. And the solution there is learning how to do exercises that restore mobility in that joint. Okay, so we've talked about the hip, we've talked about the knee. Now let's talk about how the ankle is something really important for us to look at as well. So if we were to continue this line down, because we know muscles ultimately work together, if we were to continue this line down to the muscles that work with it on the inside of the leg, we have this inner calf muscle that goes through the inside of the ankle and then actually through the arch and into the big toe, which is counterbalanced by, like we talked about, there's an opposite muscle for everything in the body. These muscles through the outer part of your calf, outer ankle. If you've ever had an ankle sprain, you're probably familiar with these muscles. They're called your peroneal muscles, and they go into the outside of the foot. Now, because those control the inner and outer movements of the lower leg, they can easily impact what goes on with the inner part of the thigh. And this is why looking at ankle mobility, as well as the balance between the activation in the muscles on the outside of your calf and the inside of your calf, can both be really important too. So ultimately, this inner knee pain is very common. It's often for people very treatable with the right exercise program. What we need to look at is your knee mobility as well as your hip and ankle mobility. And then another layer that we need to look at is the strength balance and how these muscles are activating along this entire chain. All right, thanks as always for tuning in. Pop your questions below and I will see you next time.